Hello, and welcome to today's Lunch and Learn, Bring Your Care Home. I'm Dr. Steve Reinches, the President and CEO of North Kansas City Hospital and Meritas Health. Thank you for joining us. Home health care organizations offer a wide range of services. Choosing a provider to care for your loved one is an important decision. Our home health program is consistently ranked among the top agencies in the United States. Those rankings mean that you can have confidence in the care we bring to you or your loved one's doorstep. Vicki Landers is one of our compassionate home health staff members. Vicki is the Interim Director of Home Health. She will discuss the benefits and the levels of home health care, our own services, and what to look for in an agency. Vicki earned her doctorate in physical therapy from Boston University and holds an adjunct faculty position with Rockhurst University. Vicki is joined by Kay Findley, a North Kansas City Hospital home health occupational therapist. Kay will talk about a new North Kansas City Hospital program that provides 5 months of no-cost care to eligible people in Clay County. That's amazing. It's called Capable. A registered nurse, an occupational therapist, and a home repair specialist together work to assess and address the health and safety needs of its participants. So please help me welcome our speakers today.
Thank you so much, Dr. Righteous. So I'm really glad to be here talking today. Again, I'm Vicki Landers. I'm the Interim Home Care Director for North Kansas City Hospital. We provide home health care in the home. So there are actually different kinds of care that people can receive in their homes. And we're going to talk about the different kinds, what we do here at the hospital and what other organizations might do. So there's home health, there's in-home care, and then there's something called private duty or private pay care. So home health is what we provide. We are a Medicare certified home care agency. We provide care that is covered by most major insurance payers. So we've got Medicare and Medicaid and most commercial payers, depending on your insurance plan. What we provide are what's called skilled services. So that means they're services that are provided by a registered nurse, a physical therapist, an occupational therapist, or a speech language pathologist. These services are usually short-term, and people are like, well, what does short-term mean? Short-term means that it's generally less than 60 days in duration. Sometimes we'll see people longer, sometimes it's shorter, but that's what we mean when we're talking about short-term. For most payers to cover home care services, the patient actually needs to be homebound. Now, homebound is a description, not necessarily a choice. Homebound means that you can't get out of the house without considerable and taxing effort. Those are Medicare's words. But it means that it's hard, that if you get out of the house, that it is exhausting, or you may not be even able to do it by yourself. So most payers require that in order to cover the services that we provide. We also have to have orders from a physician, because your care that we provide is actually coordinated by us and the physician combined to make sure that we're really providing good, solid care for you that's interdisciplinary in nature. Our visits are intermittent. We don't move in with you. We come and go, and we schedule those. Our staff are in contact with each other and with you so that you know when we're coming, but we do come and go. The thing about our agency and any agency that provides these kinds of services is that we are licensed with the state, and we have a lot of state and federal guidelines that we have to follow. And all of those are in place so that you know that you're getting the best, safest, most effective care possible. So we do like to talk about what Medicare doesn't cover. So Medicare doesn't cover 24-hour in-home care. It doesn't cover meals delivered to the house. It doesn't cover somebody to come in and do your shopping and your cleaning and your laundry. And it also doesn't cover things like personal care if that's all you need. So in-home care is a different kind of care as well. And this is something that's covered by Medicaid. These are not services that we actually offer in our Medicare certified home care program here at the hospital. This is something for people with chronic needs, and they also have to follow state regulations and have to be ordered by a physician. Then there's an additional kind of service that people provide in the home, and it's private duty or private pay care. And most of the time, these things are covered by long-term care insurance, or they're actually private pay. Sometimes these programs are nursing services, or maybe aid services where somebody sits in the house for 4 to 6 or maybe 8 hours during the day. These kinds of services don't require a physician for the personal care, but do for nursing care. Most of these agencies, if they only provide one kind of service, do not have to be licensed by the state. So let's talk a little bit more about us here at North Kansas City Hospital Home Health. We opened in 1994. We currently serve between 3 and 330 patients on our caseload on any given day. And we cover 4 counties: Platte, Clay, Ray, and Jackson counties. We are licensed in these counties by the state, so we are not able to see patients outside of those 4 counties. But we keep ourselves very busy within the confines of this geographic area. So the other thing, or some of the actually things that are special about North Kansas City Hospital, is that we were the first home care agency in the Midwest to be nationally certified by the American Heart Association as a home health heart failure agency. This means that we meet their high criteria for providing care to patients who have heart failure who have been discharged to their home. Our goals with these people are to keep you out of the hospital and to help you better manage your heart failure. We were really excited to get this designation, and we hope that this information gets out to the community so that everybody knows that we provide a really high quality level of care for the heart failure patients. We also, this was the 5th year in a row that Strategic Healthcare Programs named us to the top 20% nationwide in patient outcomes and patient satisfaction scores. So what do we do? What do we provide? We provide nursing. What does our nursing staff do? They do assessments, they do teaching, and they may teach about diabetes, heart failure, wound care. They provide a lot of education for the patient so that you can better care for yourself when we're no longer there to provide care for you. We do IVs, we do wound care, we teach ostomy care, and we do labs, or we draw labs and bring them to the hospital for people as it relates to those other diagnoses or things that might be going on with the patient. We also have physical therapy, occupational therapy, and speech language pathology services. We have a home health aide who comes out and assists with some personal care activities. And we also have remote patient monitoring. So what that means is that we, for some patients, we will leave equipment in the home so that you can actually gather your own vital signs and they get transmitted to us. So again, we can provide better care for you. We also have our Capable program that Kay is going to talk about in just a minute. And we also have a very small private duty program where we will have one of our staff come out and draw labs for patients who are really unable to get into the lab, but don't qualify for any other kind of home care service. So some of the things that are specialties that we provide is we have a certified wound care nurse who really helps us make sure we're using all of the right wound care products for you and helping you get your wounds healed. We have remote patient monitoring. We are so lucky that we have 3 occupational therapists on our staff who are certified as aging in place specialists. So they have a deeper level of understanding of homes and how you manage in your home and can make evidence-based decisions and recommendations so that you can continue to stay in your home as long as possible. We also have a physical therapist who is certified as a fall prevention specialist. And we have two therapists who are certified as lymphedema specialists. So we're really lucky that we have a staff that values education and advancing their education, because the whole purpose of home care is to take care of patients and to take care of you. So if you're looking for a home care agency, there are things that you need to think about, things that you need to know so that you can make the best choice. You want to make sure you pick a home care agency that provides the services that you need. So you want to think about, do you need nursing care? Is your focus physical therapy, occupational therapy, or speech language pathology needs? Do you need social services? Because we also we have a social worker who can provide social work services. Or do you need home health aid services in conjunction with any of those other services that we provide? You want to be able to compare the quality of the home care agencies when you're selecting one. And in a couple of slides, I'm going to talk about that a little bit more. We do have a checklist in this slide deck that can help you make those decisions so that you can think through your choices when you're looking for a home care agency. So this is the home care agency checklist, things for you to think about. Does the agency you're looking at have the staff? Do they provide the services that you need? When is the staff available? Something about our agency is that we do have somebody who answers our phone 24/7. And so you can always get a hold of somebody if you have a need. We generally see patients during the days, but we do have somebody available who answers questions whenever you might need it. You want to think about looking at the Home Health Compare website, which is on the next slide. Medicare provides information for the consumer about what rankings each home care agency has. So if you can go to medicare.gov care-compare, you can actually look at North Kansas City Hospital, see how we compare to other agencies with our star ratings and our patient quality scores. So that's what I know about North Kansas City Hospital Home Health. I hope it helped you a little bit understand what we do. And now Kay is going to talk a little bit about our Capable program.
Thank you, Vicki. So good to be here. And as Dr. Ranches had said, Capable is a program that actually we didn't start it until March of 2022. So it's pretty new, but I'm pretty passionate about it. We've seen some great results. And I want to let you know what Capable stands for, because I get asked all the time. It stands for Community Aging in Place, Advancing Better Living for Elders. As I said, it started in March, was our first client that we saw. It's in collaboration with Clay County Senior Services and Rebuilding Together. It's been such a good relationship so far, and everybody is so excited about it. Eligibility. In order to be eligible, you need to be 60 years or older. You need to be a resident of Clay County and own your own home. I will give an exception to that. We have done a couple of clients that live in apartments, and we got permission from the managers to do some modifications in the apartment. So that has worked out, but most of the time people own their own homes. You have to have some difficulty with activities of daily living, such as bathing, dressing, grooming, eating, or walking. And individuals with certain medical conditions cannot be eligible. An example of that, they have to have good cognitive abilities, because they have to be able to participate and understand what the program is all about. And as Dr. Ranches said, there's no cost to participate. It's all grant funded. I want to talk about some success stories we've had. We've had about 9 clients so far. We finished up with 2 of them, so we have 7 that are active right now. The before picture on the left, this was a client that exited her home to get to her detached garage from her deck. And she was having difficulty getting down from getting down and up. She had kind of a, they put kind of a modified step in there for her to use, but it wasn't working. So Rebuilding Together, we had the handyman come out, and he put in these low-rise steps with 2 handrails, and she's now able to carry her groceries up the steps. She is so thrilled with this. We also put a which I don't have a picture of that, but we put a little kind of a small grab bar by her back door. So when she goes into the house, she's able to go in safely. Another client, this is the same client. We did her bathroom. We put grab bars in her bathroom. We put a handheld shower. So she already had the tub bench in the tub. So she's able to sit down safely and hold on to the grab bars to get in and out and use her handheld shower. She was also having a hard time getting in and out of her garage. So they put a low rise step with one handrail, and she again was so thrilled with this. A couple of other clients we did some work for. We had a gentleman, actually was our very first one. His name was George. He lived in a home where the driveway was an incline down to the home. And so in order to get his mail, he had to walk up the driveway, cross the street with his walker, get the mail, come back across the street and down an incline, which was not safe at all. So he applied for a hardship with the mail or post office, and they rebuilt it together, put a mailbox on his house, which was right outside his garage. So the mail would now come to his house and he would not have to walk up that incline anymore. So he was so excited. The other thing we did for him was put in elevated toilet seats with arms on both of his toilets, and his wife has dementia. So this also benefited her, but they could both get on and off their toilets easily. And he was so excited about that. One other one I want to mention is we had a woman we worked with, and she was hard of hearing, could not hear her knock on the door or a doorbell. And she did live in an apartment. And we put in a battery operated doorbell with a flashing light on the inside so she could see when somebody was at her door. And we also put in grab bars in her tub so she could get in and out easily. Those are just some of the things we've done so far. Like I said, we're working with others to improve their lives so they can be independent and safe. If you would like to make a referral for us to come out, you can call North Kansas City Home Health, and the number is 816-691-1358. We do have a person that does the screening. They'll take your the name and the phone number and any other demographic information. Then she will ask questions and kind of do a screening process to see if the applicant qualifies. You do not need a physician's order, which is really great. And the program is entirely funded by grants through Clay County and through North Kansas City Hospital. And that's about all.
I think that's fascinating. I have known for a long time the great work that home health has done and the many awards, national awards that they have won. I did not know about this capable program and the idea that we are providing at no cost the opportunity for people to stay in their own homes is truly remarkable. That is truly serving the mission. So with that, we have a few questions from the crowd. Here's the first one. How does a home health agency keep my doctor updated? And these questions are for either of you. Just jump in.
We talk to the physicians a lot. We communicate via phone back and forth. We communicate via sometimes email. Sometimes we do it via faxing. But it's a team effort. The physician is directing the care, but we're the eyes and ears on the ground so that decisions can be made. So there is regular communication that comes back and forth.
So I don't even have the foggiest idea to this question. How much does home health cost?
So it depends on to the patient. If you have Medicare as your payer, there is no cost to you. Medicare covers home care services 100% as long as you meet the qualifying criteria, which is that you're homebound and that you have a medical need. We are required by law to inform you if you have a payer that's not Medicare. We're required to talk to the insurance and to find out what your maximum cost might be. So you actually always know this before, when our first clinician walks in the door, you're going to have that information up front that's individual to you. But again, for Medicare at this point, it's covered 100%.
Great. Here's another question from the audience. Can you make regular daily phone calls to check on a person as part of the home health program?
So that's not really part of the home care program, depending on the situation.
Yes.
We do contact if it's a patient who we're really concerned about the volatility of their medical condition,
Mhm.
we will probably make more regular phone calls. We'll do that as part of our, potentially with our remote patient monitoring. We'll do visits if we're really concerned about somebody. So the phone call frequency is kind of tailored to the patient's needs and what's going on.
We do focus phone calls in between visits if we think there's a need for that, where we'll call and just really get some good information from them and how they're doing, and then kind of follow up with that.
Yeah, because sometimes phone calls result in another visit.
True.
Really? So what is the average number of visits that home health takes place per week or per month? What's the cadence, the regularity of those visits?
For an individual patient, so let's see. We average 17 visits per episode of care for any given patient. But what I can tell you is that the volume of visits that we do in our agency per week, actually, I can't even do that math. It's a lot because we have 330 patients on service, and some of those patients may get up to 5 visits a week, and some of them may get as few as 1 visit every other week.
So when somebody has home health services and they need something done, we talked about occupational therapy like you are, but can you explain to the audience what's the difference between an LPN, a medical assistant, an occupational therapist, an RN, and how do you know who gets sent out to the visit?
Well, normally, I would say the occupational therapist looks at ADLs, looks at safety.
Okay, ADLs, you got to teach me.
I'm sorry.
I'm slow here. I'm
activities-
slow here. You got to
activities-
go at my pace here.
Activities of daily living. So how they do with dressing, bathing, toileting, eating, meal prep, laundry. How do they deal with those things in their own home?
Mhm.
And a physical therapist works on mobility and lower extremity strengthening and balance. And we do sometimes cross over in that. And then if there's any nursing needs, the nurse will be in. We do not all have to be in. We can be in there, by ourselves if needed, but it's usually starts off as a team effort. And then we just kind of, we do a lot of coordination of care among ourselves
Mhm.
and kind of figure out what's the best way to go.
So I remember on one of the slides, you said that North Kansas City Home Health is allowed to go into 4 counties, Clay, Platte, Ray, and Jackson County, and that the state regulates that. What does home health do for background checks of the people that we send in to the homes?
So it's part of the state regulation that one of the things that we have to do on everybody is we do this family care safety registry verification to make sure that any of the staff that go into the home are not on a list that excludes them from being able to provide service.
Mhm.
We also do something where we verify that they are not an excluded provider from the Medicare program. So Medicare has reasons that they don't allow some people to bill Medicare because of something they've done in their background. That's done. That verification is done for every single employee. We also do criminal background checks on all of our employees. And all of those things have to come out clear for somebody to actually work in home health.
Great. What about pets? People love their pets, but I'm sure people have allergies to cats and dogs. How do you deal with the pet issue?
I've been bit twice, but we as OTs, we work with that because the patient may be home by themselves. They have to let their dog out. They have to feed their dog. They have to bend over, and so we do adaptations to make it easier for them, and so they're safer. But yes, people really care about their pets.
And that's part of the wellness
Yes.
of the home health patient. It's interesting that you develop or train the patients on adaptive skills so they can care for their pets.
Yes.
I never thought of that before.
Yes.
So we've talked about people that need home health, are people that have a significant barrier to coming out of their house for care. What about the transition from home health care to a facility? Because it's at some point people do age, their capabilities decline. Does home health either assess people on when it's time to move to a facility, or do they help with that transition to move to a facility for care?
So we do a lot of assessing. So we'll get a new patient and our clinicians are going to go in and they're looking for safety and potential for improvement. So if we have concerns that this patient isn't going to be safe at home or isn't going to have the potential to improve to become safe, then we may actually start the referral process of helping them move to a different level of care. Most of the time, because our care is short-term and intermittent, when we come to us, we can very quickly kind of ascertain whether home is going to be the best place for them.
And do you make that recommendation to the patient or to the patient's family, or?
Yes, patients, family,
just a
physician.
discussion.
It is right, because everybody has the right to make their own decisions. We have an expertise that we can share information with people so that they're better able to make informed decisions. You know,
Yeah.
so we can say, this is what I saw that was unsafe.
Yes, I had a patient last month that came home from acute care and just was not able to take care of herself safely. Her sister was, staying with her from out of town. And with my assistance, we called a physician and we got her into an assisted living, and she was in agreement.
So it's a dialogue between
Yes.
patient and family and physician.
physician.
Absolutely.
Okay.
Mhm.
And you're the kind of eyes on the situation.
Correct.
That's great. Well, thank you, Vicki and Kay. I thought it was fascinating personally. We hope this presentation was informative and helpful. October is Breast Cancer Awareness Month, which is timely for our next Lunch and Learn. Please join us on Tuesday, October 11th for Mind Over Mammogram with Dr. Chris Foreman, a radiologist with Northland Radiology, who is going to discuss mammography. And for our viewers out there, remember to get your annual mammogram. My wife just did it this week. Anyway, thank you for joining us and have a good afternoon.